British Columbians have been applauded not only nationally, but also internationally for our COVID-19 preparedness, response, and recovery. Leadership from Minister Dix and Dr. Bonnie Henry has been integral to our pandemic response. Wave 1 has taught us that when we are united in our efforts, we can bend the curve. We need to work together again and stay strong to safeguard our loved ones, our communities, and our health system. Fraser Health is BC's most populous health authority and serving 1.8 million people from Boston Bar to Burnaby. While Fraser Health represents a significant percentage of the total BC cases, we also know that COVID-19 knows no boundaries. That is why it is so important that everyone in every part of our province does their part. From what we are seeing, even small gatherings can be risky right now. At this crucial time, we're asking people who reside in the Fraser Health region to take a pause and reconsider our social interactions outside of our households. This is in addition to the public health order Dr. Henry shared earlier this week. Ensure your Safe 6 are always the same Safe 6. As much as possible, please socialize with people outside of your home, such as public outdoor spaces like parks or licensed COVID-19 safe businesses. If you need to bring someone home, please ensure that they are part of your Safe 6, the same 6, and that you're able to visit in a COVID-safe way. Fraser Health family is made up of 30,000 staff, medical staff, and volunteers. Heroic efforts are made on an hourly, daily basis to protect the public. Some of the examples include effective case and contact tracing, which we've had 26,000 people to date, an expansion of testing and surgical services, and rapid deployment of patient-centered virtual care services. I'd like to take the opportunity to thank all of the Fraser Health family, and I'd also like to thank Minister Dix, Dr. Henry, again for your support and for joining us this afternoon in Surrey. We have bent the curve before and we can do it again, and now I'd like to invite Dr. Bonnie Henry to share today's provincial update.
Oh, hi. Dr. Lee said that people in Fraser Health should reconsider having people over. What does that mean? Are you ordering people in Fraser Health not to have their Safe 6 over, or is it just a recommendation? And if it's not an order, why not make it an order? Lots of other provinces have different regional restrictions based on where the high COVID numbers are.
Yeah, so we have an approach here in British Columbia that we've taken together. There is the possibility of adding regional specific orders, but we know that most people are following the recommendations that we have. And it's very clear for people to see from the data. We know there's a lot of transmission in some communities more than others. And it's not limited to the Fraser Valley, but it is certainly, in the last weeks, we've seen cases here. So this is a strong recommendation from myself and from Fraser Health that we need to pay attention to that in our communities here. And we know the communities, Fraser Health has worked with each individual community. We know there are many people in the communities here who live in large multi-generational homes where transmission of this virus could be especially challenging. So we are asking people to pay attention to that, to understand the risk that is in your community, and to take those measures that best protect you and your family and everybody in the community. I don't know if you want to add to that, Victoria. Okay.
Shannon, do you have a follow-up?
So, to be clear, we could see what is essentially a lockdown again in Fraser Health without it being a province-wide order. Can you speak on your thoughts on something like that with the numbers we're seeing now and the consideration that outdoor gatherings aren't as likely in the wet and cold weather?
Yeah, so we have never had a lockdown as we know them from other jurisdictions in British Columbia, and nor do we intend to. Our plan, which we've worked on together across the province when we started our restart, was it goes in one way only, and that we need to learn about how do we live with this virus and reduce those settings when we know transmission is happening. So we addressed, for example, when we were seeing transmission in nightclubs, and when we saw the transmission, we worked with industry, put in additional restrictions, but we were still seeing people getting together and breaking those rules. And it's very challenging for people to enforce those rules in places like banquet halls and nightclubs. So we issued an order to reduce those settings. We had the same idea when it happened in the summer when we started to see parties and in vacation rentals. And so this order that I put in today is aligned with that. We have now started to see, particularly since Thanksgiving weekend in the last 2 weeks, quite a dramatic rise in transmissions that were related to gatherings in people's homes. So we may have a wedding where part of the ceremony is in a church or a temple or a gurdwara, and the rules are followed there, but then people go back to somebody's home and they aren't able to maintain those distances, and people inadvertently spread it, and we're seeing it being spread to hundreds of people through several events of that nature, even small events. And I mentioned the tragedy of the woman who died this week in Fraser Health. It was a small event in a home where people inadvertently brought the virus in, and the majority of the people in that event were infected. So now is a time where we need to pay attention to this. We know as we're going into cough and flu season that we're going to have more people who are sick, and it's going to be challenging to know who has COVID and who has something else, and that we need all of us to think about not putting those expectations in place that people will come to our house for a celebration. We need to make it okay for us to stay apart safely through these coming months. And that is what we need to do to find our way through this stage of the pandemic in BC. We don't have any intent of closing down those important things in our community that keep our community strong and well. And that's things like having as many businesses as possible open with their COVID safety plans, having essential services open, continuing our surgery renewal in our healthcare system functioning as best it can, and making sure that we keep our schools open for the health of our children. So that's the philosophy. That's how we're moving through this pandemic, and it has worked for us. And we are looking to people in British Columbia to pay attention to that now, because we are in a danger zone, and we need to take these actions to make it okay if we're hosting to say no, to not invite those people we're closest to put off the parties and celebrations to a time when it is safe.
Lauren, do you have a follow-up?
I do. When it comes to messaging in Fraser Health, specifically Fraser Health, could there be better messaging? Some people have suggested to use the need for messaging in other languages, even in news conferences. When it comes to messaging, is there a point when you feel we should look beyond messaging and revisit how these health orders and policies are being enforced?
Certainly enforcement's a part of it, and the fact that we put it under orders means that we are now able to use a broader group of people who are able to enforce, and that includes police officers and public safety provincial inspection officers from around the province. So that is one of the reasons why we do have the orders that we have in place. But we also know that we have not had to resort to enforcement for people to understand and follow the advice that we're giving. And that's really important. And I take your point about messages. We have been doing outreach to a number of different communities in the past week in particular, recognizing where people are being infected. And we have continued to do outreach to community leaders. And I really want to actually appreciate the work that has been done by many of the faith leaders around this province. We have had a number of conversations, I think 5 or 6 calls with faith leaders from around the province about the importance, when we're going through a crisis like these, the importance of having our faith community to support us in doing the right thing, in keeping people safe, and still being able to have that connection to our faith community. So I do want to thank and express my gratitude to the many leaders, and I'm looking to the community leaders as well to help us reinforce the importance right now of keeping our celebrations to the small and safe ones, and keeping the larger celebrations of life or parties or other important memories to a time when it's safe to do that.
This question is actually for Dr. Lee. There remains some confusion about how people in the Fraser Health region should treat their safe six. You seemed to indicate earlier this week that there were separate rules for people living in the Fraser Health region and that even safe six people should not be invited into homes. It seems you've backed off that today. Can you tell us why?
Thank you for that question. I think it's a clarification because we've said that you should not have even your safe six in your private home to have parties and events and celebrations. Now, we're also asking everybody that because even small gatherings can be risky, even with your safe six, to really take a pause, reconsider whether it's necessary to have people over in your home. And if it is necessary, to have that visit with a small number of people. So I think that's the nuance that we wanted to clarify today, because we saw some of the information that go out earlier that seemed to misinterpret some of the guidance that we provided in terms of the recommendations.
Joel, do you have a follow-up?
Yes, please. This one will be for Dr. Henry, and if I could ask for Minister Dix to answer in French as well, that would be helpful. Would you consider increasing the number of public briefings each week in BC, given the increase in the number of cases in the province, much like how Ontario has daily COVID-19 briefings?
I guess I could probably answer that in French too. No. No, you know, we have daily statements that come out that provide important information about the progression of the pandemic here in BC. We have been at 2 briefings a week, and that has answered most of the questions. We've exhausted many of the questions most days. We also have outreach that we're doing on other days to different groups around the province, and we also have work to do in between times. So I think we're at a good place right now. I was actually looking to move to perhaps 1 day a week of media availability, but we're staying steady where we are right now, given the situation that we're in.